Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs in the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome back to another episode of the Unreal Results podcast. I got one more of the LTAP Level 1 alumni interviews for you that I had recorded on some Facebook Lives. I am just loving these interviews so much that I decided, you know what? I need to plan on doing one a month or one every other month just because I love it. I love hearing from the people that have taken the course. I love to hear how they're implementing it in their own practice with all the different types of practices and all the different types of patient populations, what skill sets from a treatment standpoint they're using. It's just fascinating to me. And then also to hear the results. I am continually blown away by the results people get. I mean, I'm not surprised. I know it works, but it's just, when I first started putting it out there, it was always is this just me or is this the assessment? And it's overwhelmingly, it is the assessment. It is not just me. As much as I want to be a magic little healer, fairy, one of a kind type of person, I just don't think I am. And that's a good thing. So, yeah, I hope you enjoy. This live is Taflyn. She is a pelvic physical therapist up in Santa Cruz, Bay Area, California. And Nikki is a movement practitioner that works with dancers in the Salt Lake City area. So enjoy. I hope you like what they have to say. Welcome. We're in the Missing Link Facebook group. I've got a couple more alumni to chat with you all. As you've been seeing every day, I've been trying to bring as many people in here as I can to talk about the LTAP, so you're hearing it from somebody other than me, because obviously I am biased. I created it. I think it's great. And then also, I'm very limited in sort of the information I can share in terms of using it with all populations, because I work with athletes. And so part of the reason I bring alumni in is I want to get you all to have an opportunity to hear from them how it works with various populations. So today joining us on our live, I have two guests. Taflyn is a pelvic physical therapist up in Santa Cruz in Northern California. And then Nikki is a movement practitioner in Salt Lake City area, right? Yeah, Salt Lake. So I'm always I don't know how new you are to me, but but Nikki just did an in-person course with me this past weekend in Denver, and then did you do the online course before?
I did the online course
in the fall, yeah. And then Taflyn has been to level 1 in person and my beta level 2 in person with me, and also done the online course last fall or spring. I can't remember.
Yeah, I think it was in the spring.
In the spring, okay. So, yeah, they both have different perspectives that they're gonna share about, but I'm just gonna sort of give the floor to each of them at a time, so you guys can introduce yourself and share again, your profession and what population you work with, and maybe the unwanted experience you were having that led you to the LTAP. So either of you can go. It doesn't matter to me.
I guess I can start.
Go ahead.
So, my population, if I get off course, just,
Oh yeah, I'll reel you back. Don't worry.
Okay. My population, I'm working with a lot of dancers right now. And the reason I was interested in the LTAP is because I had been taking a lot of biomechanics courses. And then I started a neuro master training course that I've been in for a year and a half at this point. And so in neural, they say, oh, we start with the nervous system. In biomechanics, they say, if the lower limb doesn't move, nothing's going to move. So I was kind of at this place where I was like, okay, so what if it is a lower limb? Is it always going to be the nervous system, or could it be the lower limb? So that very question was where my brain was. And then I think it was an advertisement, and you nailed my question that had been kind of percolating for, several months at that point. And I was like, "Oh, this is the very question I've been pondering." And then I was like, "I have to sign up for this course because I've been thinking about this now for quite a while and I want an answer."
Yeah. Yeah. So you had the question of like where to start. Like,
Yeah.
yeah.
Yeah. Because the nervous system, the people in neural were like, always
Right.
with neural. And I was like, always, whenever anyone says always, I'm like, always, that's
That's strong.
easily not
Yeah.
always.
Yeah. Speaking in absolutes in a world
Yeah.
of relative is like very strong.
Yeah. Exactly. Exactly.
That's
So
awesome.
that's kind of what led me into your course. And then once I got in the course, I was really glad to see the inclusion of viscera because I had never really considered that. And then I started thinking about, yeah, like what do we do when we have a stomach ache? We lean over and hold our stomach. So
Yeah.
why wouldn't that posture affect all movement? It would. And
Yeah.
I just hadn't really considered that because I had done, fascial fitness training and, a lot of other things, but I hadn't really considered that idea. So considering that, that definitely changed, my approach to how things were going. And then using the assessments, just feeling like I have a quick assessment because I do feel like I can run through some of it pretty quickly compared to some of the other stuff I was doing.
Yeah.
Uh,
Absolutely.
and getting started right away, or continuing to assess, whatever is needed really helped with like feeling like I was making progress really quickly with interventions.
Yeah. I love that. How about you, Taflyn? What was your why for coming to the LTAP?
Um, I heard you on a podcast some years ago and I was very intrigued.
Mm-hmm.
But that was, I think, a little bit before I was starting to be interested in visceral work. And then I started taking some visceral and neural like mobilization courses in the context of pelvic health,
Mm-hmm.
like through organizations that train pelvic health physical therapists. And I was just like, I'm learning this technique and I'm learning this technique. And they, most of them had like done their original training with the Brawl Institute, but they weren't teaching like listening or ways to like find out where to start. So I just felt like I had like a million techniques of different things. And based on what like a patient complaint would be, I would be like, well, we could do this or we could do that. So I was also kind of like where to go.
Mm-hmm.
And in pelvic health, I work with like a very varied population. I see women and I see men and I see like sometimes trans people
Mm-hmm.
and people of all ages as well. So it could be like quite variable who I'm seeing. And sometimes with people with pelvic pain, it's like very complex and they've had symptoms for a long time and they have like 17 things going on. So in those cases, also it would be like, where do we start?
So much. Like, oh my gosh.
Yeah. So kind of in my like more journey into being interested in visceral and studying that and being interested in nerve stuff as well, personally having experience with that. It just was like a nice blend of the two areas that I wanted to be able to like have a better idea about how to help people with.
Mm-hmm.
Yeah, and it's been fun to see sometimes like things change more quickly when I use that assessment.
Yes. And so, I mean, that's one of the things too. And, it's nice that you're here. And I think too, even Nikki, in the dance world, you get some complex people because of like a lot of times people with hypermobility syndromes have a lot of complex pain problems. So you kind of both work in that setting. And I mean, the complex patient is so challenging because they do have such a robust medical history or pain history, or like even just like clinical history with other practitioners, and so they've been told all these things about their body and all these things that are like maybe wrong with their body, or how their pain's connected, or how their pain is like part of their stress, or like, I mean, I'm sure it runs the gamut of what they're told. And so I do believe, I mean, from people like you who've been taking the work and working with people, like, I do believe this is a really great tool to have in those complex cases to keep you sort of unbiased about all of those stories, and even to let them sort of like let go of all those stories and realize that that's probably not true. A lot of them are probably not true. And so, yeah, are you seeing results with those complex cases being a little bit easier to navigate, or is it still sort of?
It feels like layers of the onion. Like,
Mhm,
I feel like I'm on the right track if, like, different stuff is showing up from
mhm.
time to time,
Yeah.
like, session to session. Like, if I find something and then we do a treatment and we make a change, like, in that session,
Yeah,
then in a subsequent session, if I'm, like, drawn to a different part of the body or directed based on, like, the LTAP, like, then I'm like, "Oh, that thing is more not so much of the problem at this
yeah,
point." Now there's, like, another layer that, like, needs to be addressed.
yeah. That makes sense. Yeah, I like that, and, along with those layers and you seeing, like, a change clinically in whatever you're measuring, the objective measures or the tissue quality or whatever, are you finding that their symptoms are sort of being like that too? It's like, maybe, like, one symptom at a time or a couple symptoms at a time are resolving, and now they have a little less to focus on?
Mhm, yeah, so they're not like, or, like, they're like, "Oh, this was bothering me so much, but now I'm realizing that, like, that's mellowed out, that I just have this, like, other thing going
Yeah,
on that's, like, maybe not as, like, much like pain or other symptom," but they're like, "Oh, that area is, like, tight," or something like that.
right. And I'm assuming too, sometimes with patients like that, especially when you're starting to get results for them and they've probably never been with a practitioner to get them very good results, they're like, "Oh, well, now that you've taken care of this, and this, can we work on that too?"
Yeah. Yeah, exactly.
Yeah.
Because especially being in pelvic health, people are like, "Oh, you just work on my pelvis," right? Or
Right,
like, "I don't know if I can tell you about, like, my neck pain or my shoulder pain or my,
right.
whatever else is going on, or that old
Right.
ankle injury," and I'm like, "It's all connected potentially."
Yes, absolutely.
Yeah.
Yeah. How about you, Nikki, with the type of clientele you see?
But yeah, I mean, just speaking to what she ended with, like, it is all connected, and I love, how you emphasize, we came from a single thing and we still are a single thing. We're not parts.
Yeah.
And sometimes I think my clients, especially, think of themselves in parts. I don't know if your athletes do that, but my dancers definitely think it in parts of themselves. And so
Mhm.
um sometimes it's a little bit like, well, my ankle hurts and they want you to go right to your ankle or right to their ankle.
Mhm.
And so I just say, well, let me do some assessments and let's see, where we go. But I do feel like I get results pretty quickly.
Yeah.
It might not be instant release of their ankle tension that they're feeling, but as we unpeel the layers, we
Mhm.
start getting more and more movement that's clear to them and is clear to me. And it's fun because I have I have students that I teach, and sometimes I give material in classrooms, not assessments, but just some
Mhm.
of the neural stuff, and they call me the magician because they
Yeah.
don't understand how it works. And they're so used to just going hard, 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 they think they have to train until they're, bleeding.
Yeah.
And so some of it's just, a completely different approach, more parasympathetic, and,
Mhm.
they get movement and then they wonder like, why I was trying to do the splits for years and you just gave me a pencil push up and now I'm doing the splits and it makes no sense to them. But it's really fun to be able to see, the changes in the body and with the assessment in individuals, like, yes, for sure. I feel like I can make progress really quickly, and it's not always exactly like, I'm still working on my skills, but I feel like it is always progress and
Yes.
it's always unraveling. And that's really fun to see.
Yeah, that is good. And I think you kind of said it, you know, how your population is like, they think in parts. I think it's a little bit of the nature of the beast sometimes with athletes and people who have complex cases and a lot of chronic pain sometimes too. So all three of us have this tendency to have these patients that I always tell them are kind of like floating heads. Like they're very like thinkers, and they're very good at pushing past paying attention to what they feel, because a lot of times what they feel, they don't like it, and they have to ignore it in order to progress, in order to like heal in a way. And so it's like it is a retraining of them to like realize that they can feel safe in their body, and that also feeling safe in their body is often the path to feeling better, and that all the things that they're feeling is not like it's not bad, or it's not like it's neither bad or good, it just is. And when they can start feeling again, they get that body autonomy back, and it is just like such a powerful thing. Because again, I mean, they've been told so many stories about their body, like athletes too. They've been told so many stories about how their body moves over the years that it's just like they don't know what to believe, who to believe anymore. And yes, because we get results sometimes with really simple things, it feels like magic to them, because they're used to having to almost like disassociate and go into more pain in order to feel better, or in order to function.
Mhm.
So it's super interesting, that crossover.
Yeah. Yeah. And I mean, I like don't force the body makes so much sense, you know. When you're in fear, like old school ballet instructors in Russia would just push their kids down into the splits. And you still see those videos floating around on
Absolutely.
Instagram sometimes. And when I'm watching them, I was like, "Ugh," you know, because you know how that is to have someone pushing you past what you feel safe doing.
Mhm.
And then realizing what we know about the nervous system, that that person's likely pulling away from the movement as they're being pressed into it. Like, yeah, how is that going to benefit them long term? And you know, like, is there a better way? Yeah, there is a better the way. There's a lot better way.
Yeah. Yeah. I love that. Um, what's one of the things, or I mean, obviously, so it sounds like both of you like came seeking answers of where to start, and it did just that, gave you a framework to figure out where to start. And it sounds like knowing that is working, it's at least starting to work for your patients, which is great. So besides getting getting that, which is like awesome, is there anything else about the courses, either the online or the in-person courses, you guys have both done both, that you've either learned or like really loved about like the learning style, or like, you know, especially compared to other continuing education courses that you might have taken, that sort of like stands out to you?
I loved that. I got to, maybe this is a disadvantage in some ways, but I loved that I got to stay with the partner that I had from the very beginning of the course. It just gave me kind of a rapport. And also, I started to understand her body, or I felt like I started to understand this body instead of just going from body to body and having to figure it out again, which I didn't have her. I had my hands on other people, let me just
Yeah.
say that. But it was nice to feel like I could see changes happening even from day 1 to day 2 when I realized, "Oh, she isn't like she was yesterday."
Yeah.
To just have that experience and then have it validated when you said what you said in the course. I think you mentioned not wanting to retest, and you had the idea, "Well, I just tested this yesterday." And then you went ahead and tested it, and sure enough, it's in a different place, which makes a ton of sense because, you know, how did we sleep? Did we stress out on the way to wherever we were getting to, you know? So the body, of course, is gonna be perhaps in a different place. So yeah, I loved that. I felt like I got a lot of hands-on experience, which was, you know, something I have left other courses and been thinking, I wish I had had more time. I
Yeah.
did not, of course, more time is always, you know, appreciated, but I didn't feel like there was a deficit. I felt like I
Yeah.
had plenty of time to get very comfortable. And I walked in on Monday, like the next day. I got up, went to work, and I did exactly what I had done all weekend, and I felt comfortable. So it was great.
I love that. Yeah, that's awesome.
Yeah. I liked having a good amount of hands-on time as well. I feel like that was a lot of it was like kind of experiential, like here's the concepts, now let's practice like the actual assessments, and having help with like the specificity from you and from the TAs that were in the class in terms of like where you're monitoring or like what you're looking at or where to put your hands was helpful in that, in the real time. And then I liked the combination of the in-person and the online just because I liked having a little bit more time to like integrate the information. And I think that combination is helpful. And also to like deep dive more on the anatomy. That's the other part that I really, really like.
Yeah. And it's like we could do that in a course setting, but it takes away from then the practical time. And then also it's like can be so heavy, it can just really like weigh down the energy of the classroom because it's like a brain load. And so it's like the more you load your brain there, it's harder to like be present for the feeling. And the feeling is like really the whole reason people come in person, I feel like, is so you can get feedback from the teacher and like really see the nuance of it that you can't over video, and you can't, we do as best as we can over video, but at the same time, like it does have its limitations. So
Yeah.
I love that too. That was my biggest thing, obviously, in creating it was like, we're in this online world now, so it's like, why not use it to our advantage and make it so, we can just have a 2-day course of like completely hands-on. And then 2, realizing that what I found really powerful through the Burrell work especially was by learning their techniques, I could understand the principles of osteopathic medicine a little bit better. And, that is a quote from Harrington Emerson, who was this man in the past, I don't even know what decade, but he wrote a book about efficiency. And that was his whole thing, is like when you learn the techniques, you understand the principles. And then once you understand the principles, you can create your own techniques. And I'm like, yes, that's how it should be. Because I don't want us all to be like carbon copies of each other. We all have such unique personal experiences. We have unique patient experiences. We have unique learning experiences. We're all bringing something different to the table. So why would I ever want you to practice exactly like me, right? And so it's like just giving you the tools to experience all the underlying principles, one, makes you your own practitioner, but then 2, it allows you to sort of feel and understand those principles so deeply that if you wanted to abandon the LTAP altogether, but still honor this lens of view, you see why it's valuable. The lens of view of the whole organism and the nervous system and the viscera being like such big drivers of our protection patterns because they ultimately drive survival for the organism. And it's like, I think if I stood up and lectured at you and talked about that over and over again, it's just not as powerful. It would take me weeks or months to convince you versus like 2 days in the course to like show it to you with your own eyes and hands.
Yeah.
And that was just what I was gonna say is in my feedback in like the beta 2 that we just did was that I liked some of the ways that you were kind of like, you could do this like this, or you could do it like that, like having more like freedom to kind of experiment with like how you're implementing some of the tools.
Yeah, I love that. Way to plug the LTAP level 2.
Well, I'm just such a like rule abider. I'm like, they said it has to be like this. This is how you do it. So every time someone gives me license to like do something slightly different, I'm like, oh, I didn't realize I could like play around with it.
Yeah. Well, and this too goes back to like really understanding the purpose of everything. And this is oftentimes, especially in classes, you guys have both heard it. People are be like, how do I do it in this type of patient? What do I do for this type of patient? Or if this person can't lay down, what do I do? If this person can't stand up, what do I do? And I'm like, Well, it all goes back to like, do you really understand what we're trying to get out of this assessment? If you understand what we're trying to get out of it, then you can figure it out how you would then modify it for the person in front of you.
Yeah.
And that has been something I believed my whole career of like even exercise prescription. If you know exactly, like every single, I've been a big believer my whole career, and it's probably from my original mentors, but it was like every time you give something to someone, be very intentional with it, like have a reason. And it's better for the reason to be wrong than to not have a reason at all.
Right.
Right? If the reason's wrong, that's fine. We learned that it's wrong, and now we have a new reason, but at least we're inserting like something for having the intent behind it. So it's like every exercise program, every manual therapy piece, every even assessment piece I do like has a very specific intention behind it that I'm trying to achieve. And by knowing that allows me the flexibility, Taflyn, that you just said, is like I can do it a lot of different ways because I know the underlying principle.
Yeah, I love that. I wish I could remember exactly what happened yesterday in the studio when I was working with someone, but something
Blacked
happened.
out on it. It was so cool you blacked out. That happens to
I
people
blacked
like
it
that.
out. But something happened, and my immediate thought was, how do I make her body feel safer?
Yes.
And that was like such a great moment. And I was like, oh, see, here I am. I'm like right in the middle of a session. Something isn't going well. And my first thought is like, how do I make this body feel safer? And so I adjusted, and then I got what I needed out of whatever was going on. I don't even remember. I wish I could.
Yeah.
But it was great because I was like, just that line of thinking of instead of like, just keep doing this pronation drill until your arch drops.
Yeah.
Like that
Right.
there's another solution, and it is just like look for a way for the body to feel safer so it can release.
Yeah. Love that. And yeah, we do see that in the class. Like that's my favorite part of demoing the scoliosis padding is like, yes, we're using the scoliosis padding for the reason so we can make the assessment fit that patient population. But within that, we get this added education of still whole organism lens of view of like meeting the body where it's at and reading the person's body language and making sure that you have consent and they feel safe the whole time.
Yeah.
Regardless of the words that come out of their mouth.
Yeah.
Yeah. I have at least like 3 people like that I can think of with different like pelvic pain things. And I like forgot a couple times and I was like, oh yeah, we can't do this. They are so hypersensitive on the front of their like abdomen. And that side joint test, like I was like, oh, I can't actually put my hands here and push down.
Yeah.
They're just like reacting, guarding, like ticklish, whatever it is.
Yeah.
And I was like, oh yeah, we have to go standing up now
because we have a different way. Yeah.
I can't touch you here or push pressure in this area without it like causing a big reaction.
Yeah. I love that. And it like, and yeah, it kind of like you said with the level 2, like having other ways to do it. Like, and sometimes when it's in the moment, sometimes we're like, oh my God, I don't know another way. So it's nice. I do know that it's nice when I point people like, oh, you could do it this way instead. But yeah, it's like, again, you're just looking for the SI joint. You're just looking, can the innominate move independently from the sacrum? And so it's like, test it. If you can't test it in supine, test it in standing. If you can't do it in standing, like pick another way. One of the practitioners in the Denver course this weekend, she's like, I've always done it in seated with the seated bilateral test. And I was like, great. And she's like, and I've tested it with the breath hold and it gives me the same information. And I was like, great. And she's like, can I do it? I'm like, why are you asking permission? Yes, doing the exact same thing. I'm telling you. So like, run with it. I loved that. So
yeah. I also like just the idea that the body isn't wrong, how accepting. I had someone lay down on the table today who was totally bent to the side. And I, in the past, I would have asked them to straighten out or bring your feet this way. And I just looked and I observed. And then I was like, are you comfortable? And she said, yes. And I was like, okay.
Yeah.
And
then now you see that,
you
see that side bending and you're like, ooh, you probably have a central nervous system tension bar.
And she did.
Yeah.
She did.
Yeah, you're laying right in it.
Yeah, we worked on it and she felt better. And, I like the first thing I noticed when she walked in was her foot was very tilted today when
Mhm.
she came in and everted, I guess I could say.
Yeah.
But,
Tilted work.
yeah, yeah, and I just like observed it and then laid her down and she was side bent. And I was like, okay, well, she's comfortable here. And then we worked a little and she stood up and she goes, wow, I feel a lot better. I'm like,
Yeah.
great.
Good.
We did a couple nervous system things and she's like, oh, what did we do? I'm like, we just let your body be.
Yes. I love that. Well, and to this conversation kind of reminded me too, the journey we go on in class and like this realization of like, yeah, when you really have the intention and know exactly what you're trying to get out of the test, the body's not wrong, you're not wrong. It's just more information. And so it's like, what are you going to do with it? And so we talked about this tendency of practitioners at first when they're working through feeling this and seeing it, if they don't get information that they think they should, their first thing is like, oh, I'm an idiot. I don't know what I'm doing. Yeah, right? Like everybody goes through that. And I'm like, no, like that's not true. Like, could it be like that you just didn't set the test up for success? Or could it be that the test is not a good test for the patient because of, like Taflyn's patient, they're very sensitive to the front of the pelvis. They don't want you touching it. Of course, that's going to increase the threat and totally change the scenario. Totally going to limit their mobility because their body's like, don't touch me. Right? So it's like, instead of jumping to the conclusion of like, I'm dumb, I can't do this, like, which is our default at first, it's like, no, realizing that nothing's wrong. There's not wrong or right. It is just what is. And when we can appreciate what is, then we're calmer about it. And then we can critically think of the steps. Like, is it me? Like, could I make this better for myself? Is it appropriate for the patient? Like, is there another way I could do it to get the same information I need? And like, when we work through it that way, then like, we're in such a better spot, right? Like,
Yeah.
you don't get flustered. We accept that like the body is just always just giving us information. And like, it's up to us whether we let our ego get in the way of that info or not, right? So,
And as a practitioner, then, I mean, it does happen, but in that
yeah.
scenario that you just described, it's like I'm going into like freeze mode or
Yeah.
fight mode, and I can't feel anything and I can't reason through it.
Exactly.
So versus like, oh, let's just take a beat
Yeah. Yeah.
and like figure it out.
And that's the thing too. Like, I was in this messaging, like, business class about messaging, which is like basically the messaging is like how you resonate with your prospective client, right? It's like me talking about like, hey, like, is it the 3 out of 10 people that leave you, awake at night, like that really is bothering you and you keep learning more tools and it doesn't help? Like, that's messaging, is like saying the right words to get you to like come into my sphere to listen to me, basically. And so I'm like, oh my God, where was I going with this? Please say what you just
So we're
said.
talking about like going into like a freeze or
Oh, yeah.
as a practitioner, like, what do I do? Oh my God, I can't figure it out.
Yeah, exactly. So it's like, it's like understanding. I think what I was trying to say is like understanding that, oh, I know. Now I'm back. Okay. The messaging thing. Why I thought of that is because ultimately the soft skill, like the underlying soft skills that we're really getting out of learning these principles and like, and practicing in this way is confidence and calmness, which is like, yes, a well-regulated nervous system and confidence for our patients. So we recognize, because we recognize how important that is to be the calm, confident practitioner. So the reason I brought out the messaging class is he was trying to get us to make like a future paced hero, as he calls it. So going from like the stressed out, frustrated, burnout, stagnant practitioner, you're on this journey to be the calm, confident practitioner, right? But and as corny as that sounds, like that's what it is. That's what it is, because the calm, confident practitioner knows that it's always figure outable. That there's no reason to worry. There's no reason to like feel like you don't know what you're doing. There's no reason to like panic, because the body always has the answer if you just are calm and confident enough to like not go into that shame spiral when you get a message from the body that doesn't make sense to you. And to like, this was me, this, you know, you probably have all heard me tell the story of when my teacher, Ron Mariotti, told me, you know, when my hand was on the body, I don't have permission to think. Like if my hand's on the body, I only have permission to feel. And when I want to think, he's like, take your hands off the body. And so you'll see me do that with my patients. I'll have my hand on them and I'll be working on them. And all of a sudden it's like, I said this weekend in Denver, I was like, it's like the chef show on TV, Chopped. It's like chefs, like knives down, time's up. And my hand comes off of them. And when my hand comes off of people quick like that, that's me catching myself, overthinking, starting that little, like, not necessarily the shame spiral, but starting that, like, I'm forcing things. I can feel my nervous system changing. I'm like not being so balanced in my autonomic nervous system. And I like definitely always practice, put like, you know, knives down, like knives down. We got to like recollect. We're like slipping out of that calm, confident practitioner. And like, what do I need to do to get back there? And so, yeah, that's what I love that you guys, you know, that you all are recognizing too, is like that's the journey. And that's the tough thing too, is like, I know in my heart that that's truly the journey I'm taking you all on, is this journey towards this calm, confident practitioner that appreciates the whole organism. But the only way you get calm and confident is understanding the organism, right? And but you can't sell it that way. Like nobody buys that. It's like nobody buys confidence. They buy a skinny body when, you know, I'm still like fat loss and fitness.
Yeah, I love that, because I mean, even today with the woman that was laying side bent, when I saw her lay down, I immediately wanted to validate my theory, which was she was in a CNS pattern. And I put my hands behind her, you know, head to check her, behind her ears. And as soon as I did it, I realized I was already ahead of myself.
Yeah.
Like I'm ahead of myself and I need to take my hands off of her.
Yeah, I love that.
I'm trying to validate what my theory is, and I need to just listen to see what is really going on. And so I had to start over as I go, you know, hang on.
Yeah, hang on. Start at the beginning.
Yeah, start again. And then, yeah, sure enough, I did feel it, but I didn't want to make myself, you know, like believe the theory I had come up with, because I knew I'd be messing up my assessment if I didn't just listen. And so I was like, I have to still validate it. Like I can't just lean into my theory.
Yeah. Yep, I catch myself all the time. Still, to this day, it is a daily practice for me to not let my ego drive the bus.
Yeah.
My patient care and with my teaching and like with everything. So I love that you caught that.
Yeah.
I know we're running over the time I promised you, ladies. And so my last question I've been asking everybody is sort of like, you know, if there's a person on the fence about taking the online course or the in-person course or both, like what would you tell them beyond just like everybody loves to be like, well, Anna's the best and it's like the best class, which I appreciate. With that assumption, we already know that. Like, what are other reasons? Like, what would be what you tell them, like, to get them off the fence?
I would say that it's like, it's a practical, like hands-on assessment that's like an algorithm, not exactly, but it's simple enough to learn. And I think it can help apply like any other strategies or techniques or tools that you already have.
Yeah.
So, yeah, I think that just like being able to be like, there's just 5 steps.
Yeah.
And I don't even need to do all of them
You
necessarily.
don't even need to do all of them.
Yeah. I would say there will be value no matter, you know, like maybe you don't feel great in your assessment skills on just a 2-day weekend, but I did both the online and the 2-day weekend, and I really liked that I had information before I went in. I think I got a little bit scared when I saw how much hands-on, and I was like, "Oh, I don't know if I can do this or that." But then when I realized, "Oh, I can just side bend them, that's easy. I can just put my fingers here, that's easy." Then I realized, "Oh, this is really a beneficial, and I feel, confident in doing what is within my scope." I feel very confident about that, and I definitely feel like it's valuable and is very much worth my time. I'm so glad I went to Denver. It was great to be able to have like personal coaching from you, both as a subject and then turn around and have my hands on you and have you give me feedback. So that was a really beneficial experience because the classroom size was such that it allowed that to happen. And I was like, oh, this is so good. I'm so glad I'm here. So
Thank you. I'm glad. Yeah, that is all intentional. I hate the huge 60 people classes. Like, it's just too much. So I keep it small for that reason. And because also at the end of the day, like creating community is what relationships is what drives me more than anything. And so I'm like, yeah, it's hard to create relationship with 60 people. Even the 24 people is tough, right? Like, so that's kind of like the max. So I appreciate that you enjoyed that aspect. And yeah, thank you.
very much. Yeah. Thank you.
Thank you both. If there's any parting words you need to say, like now's the time, but I feel like we covered a lot, which I really appreciate.
Yeah, I mean, I think like I said, I like the fact that it's practical and applicable. Like it's not that complicated, but there's still lots of opportunity to deepen your like abilities and ways that you can use it. So
Yeah.
Love that.
Yeah.
Alrighty. Well, thank you for being here today.
yeah,
Thank you.
Appreciate it.